What's going on, guys? Welcome back to A Couple Nurses. In today's podcast episode, we're going to be talking about getting back into work after a month or so off between our travel contracts. We're a little rusty getting back into the flow of things, so that's what we're talking about today. Remember, you can listen to our podcast on Apple, Spotify, or wherever you listen to podcasts. Be sure to like, share, subscribe if you find any value in this content. And also check out our CCRN cram sheet. So we created our own cram sheet to pass the CCRN. It's compiled with like 25 pages of all the important information that you need to actually pass your CCRN exam. So without further ado, let's get into the episode. What's up, guys? Welcome back to Code Bull. This is Cordero.
And your girl, Monica.
And today, we have a couple topics we're going to talk about, but the main topic we want to talk about today is going to be getting back to work after a month.
Man.
So, we took a little trip to out of the country to Thailand for a little bit, and then we didn't start our contracts until we were off work for like six weeks.
Was it 6 weeks though? So we ended our contract
It was like the 18th of December, and we didn't start working until February 16th.
Damn.
Right?
So that is about 6 weeks. You're right.
Did you have any like anxiety going back into it?
I did, honestly, just because I was, and it wasn't just being away from the bedside for so long. But coming from my home hospital and, taking care of the high acuity patients that I was taking care of before I went on my first travel assignment, I was like, heck yeah, like I'm good for this, I'm made for this. Like,
yeah, especially because we were in CV.
Right. And so it's like, they breed good nurses, and that's facts. And then when I got to our assignment of hell, it just felt like I was getting gaslighted by just a certain person. When we previously discussed that in our last podcast, and not even just getting gaslighted, but it was just seeing the lack of standard of care, as some may say, just really giving your all and seeing the lack in other, nurses and travel nursing, and it was just crazy. So the anxiety just came more from an overall sense of, I just felt like I wasn't super challenged at my last facility in terms of the kind of patients that I was caring for. I was challenged more in the sense of making sure that, I'm taking care of my license and being safe at the end of the day, because I was in such a complex assignment in terms of safety and safe assignments. And again, back to standard of care. So, then completely having 6 weeks off from work.
That was a good 6 weeks.
It was a great 6 weeks.
I think that's what I like most about traveling.
Of course. And, after having like those 6 weeks off, I was like, damn, I gotta go back to bedside. I was like, do I know how to take care of patients? And of course, I wouldn't even say of course. I really feel like a lot of people end up feeling like that when they go on a long break from assignments after discussing this with other people.
Yeah.
It's just weird when it happens to you. And yeah, I had a little bit of anxiety like the first 3 days. So we got a whole 3 day, guys, on this contract.
Whole 3 days.
Well, we'll make a whole nother podcast about.
Yeah, that doesn't happen very often.
About what it's like being in an assignment that has everything that makes sense and standard of care, the whole shebang. You know what I'm saying? But yeah, it was like a whole 3 days of just on the floor actual orientation. I remember telling the nurse that I was with, I was like, hey, look, I'm just gonna let you know right now. 1, I'm not dumb. 2,
straight up.
2, I've been off. 2, I've been off for about 6 weeks. And 3, give me a little bit of a break. But also just make sure you're teaching me your policies and the way that y'all go about things. And I, gave her my little synopsis of, my background and whatnot. But I was definitely still a little bit nervous, especially at this assignment that we're now at. It's, it's half tele, and then half CVICU, because it's technically universal floor. Meaning,
let me ask you real quick.
What's up?
Do you feel like there's a sense of like you having to prove yourself, like as a travel nurse? Do you feel like you have to be like, hey, like I know my shit, like I know what I'm doing?
Man, I don't. That's a whole nother podcast. You sure you wanna intervene with that?
We can talk about it.
Absolutely. And I can understand why from both sides as to A, why can that be upsetting, but B, why why you also feel like you have to prove yourself. So I was, getting oriented by this nurse who we have the same amount of experience, but I can tell you right now, every CVICU and every ICU, to even start off with, is not the same. Thanks. And that's fine. Like, you know, you come from where you come from, maximize your time there. But I'm just saying that to say this, that the patients that I've recovered in the past are way of higher acuity from where I'm at right now. And I say that humbly, you know, just based on the experience that I've had, because it's a fact. I did feel like I had to prove myself. Like, they're over here trying to tell me how to pull a swan. I'm like, I know how to pull a swan. Like, like I do this. Like, I know how to pull a swan, you know, or just basic little things like you do this every 15 minutes. And I just remember having to stop and be like, look, like, this is what I've done before. I've recovered transplants, fresh hearts, fresh lungs, like ECMO patients, you know, unstable assignments with 2 CRTs, like, type deal.
But you know that, playing devil's advocate, you've worked at your home hospital with travelers, and you've been around other travelers who you're like, you're kind of sus, bro.
Of course.
So it's like, I feel like for them, it's kind of like they're checking you in a way, you know?
And I get it, but it's like, I think also there should, you know me and my word, communication. If you start off your day with just without the intent of being an asshole and just being a normal human being and asking the person that, you know, you're orienting, hey, like, what's your experience? Tell me what you've done before, blah, blah, this, blah, blah, that. And watch them. Like, just watch how they work. Tell them, hey, you know, if you have questions, let me know. First few hours we'll do this, and then you can just take over. Cool. Like, fine with me. You know what I mean? Like, I like that. But then again, I'm all about, you know, perception from other people's point of view. And like you said, I have seen other travelers. I have seen really good travelers. I have seen really crappy travelers. And I've seen travelers that lie on their, you know, resume, and when they got the job that they really didn't have ICU experience. So I get it 100%, because at the end of the day, we love our patients. At least I do. So I can see why people act like that. So I don't know. I like playing devil's advocate in that sense. But yes, to answer your question, sometimes I feel like I've had to prove myself, and especially it was my 3rd day of orientation. You know, I'm getting oriented by a nurse that has years and years of experience. Great. Like, and she's worked, you know, she's worked in, you know, multiple CVICUs, so, you know, different acuities and stuff like that. Like, I know that they know a lot of stuff. Like, I can already tell, you know what I mean? Yeah. But when I was telling them, like, what my background was, and it was just literally just, hey, this is what I'm doing, because I had the first person orienting me was the same for the first 2 days, and the last day was somebody different. So I felt like, hey, I know this, like, let me just take care of the day. Man, I felt like they were just trying to one-up me, and I was like,
this ain't a competition.
This is not a competition. I'm just letting you know, like, let me sail and just be there so I can ask you, you know, where are the flushes at? Or where's this set in the supply room?
By that 3rd day, you shouldn't, like, it's basically, I'm taking care of the patients, and you just tell me where supplies are, tell me what your policy is.
Right.
Not teach me like I'm a brand new nurse. Like, I know what I'm doing.
Right. And or, you know, what doctor do I need to call about this? Right. You know what I mean? Like, those type of things. And mind you guys, like, this is 3 days of orientation, which, whenever we were telling other people this, like, our friends that are travel nurses are like, 3 days. And we're like, yeah, 3 days. So this is a long time. So it's like, by 3rd day, it's kind of just like, yo, like, back off a little bit. You know, I know what I'm doing. And, like, I think what, you know, to end this this question was, you know, I had one post-op, and then somebody else that wasn't doing too hot, let's just say that. They ended up doing way worse, and it was kind of like an emergent situation. I run to them because I know what to do, you know what I mean? And so at this point, I know one of the provider's names, so I'm able to vocera it. For those of y'all that haven't messed with vocera, y'all know how annoying this is. You gotta know first and last name sometimes. So, page that person or whatever, and we're handling the situation. Here comes this person running, you know, just trying to dictate stuff, and I'm like, yo, like, I'm a nurse too, like, but thank you, like, and I feel very confident in my practice, and when I don't, I will always ask a question, and then again, I play devil's advocate, because I can understand why they may act this way. They don't know exactly what I do.
You be in there looking young too.
I do be looking young. I be in the elevator, people be asking, you a nurse? You look like my granddaughter. I'm like, okay, thanks. Like, thank you, but I can save your life. Like, thank you. So yeah, that answers that question. Sometimes I do feel like I, you know, need to prove myself, but then at the end of the day, I also understand why some staff nurses may feel that way without being petty is because they've seen unsafe staffing. I mean,
unsafe nurses.
They've seen unsafe nurses or nursing, and they've seen people lying on their resume. So I get it. Like, 100% get it.
I was pretty nervous going into the job. I think I told you this the other day.
Yeah.
Because it was CVICU. I've worked kind of like in a dual CVICU, and I've taken care of a lot of cardiac patients, but it was no level at like the type of CVICU you worked at.
Right.
And I remember you used to come home, tell me about your stories. I'm like, okay, like I never taken care of a lumbar drain. I've never taken care of fresh lungs. Like, I hope I'm not getting any of that shit here because I'm not gonna be asked out.
Right.
But I do know cabbages. I do know my hemodynamics. So like I'm confident in what I do know about the heart. But now that I'm here, I feel even more confident because I'm doing this.
Right.
So yeah, I was definitely nervous, especially after 6 months. We said we were going to take a week.
6 months, 6 weeks.
Or 6 weeks. We said we were going to like take a week to like look over all our stuff.
Man, we didn't look at Jack.
Nah. That vacay was on point.
I mean, we were fine. The thing is, we're somebody that we carry our backpack. We have our resources. We're always looking at stuff. And I think at the end of the day that the personality that we both have is when you don't know something, you're not just going to guess and do it because, quite frankly, we're not in a career that grants you the liberty to do that, Yeah. So I knew we were going to be fine. But yes, going into it, the nerves were definitely there.
And this would be our last question for this episode.
Okay.
How would you compare the hospital we're at now compared to the hospital we came from?
Oh my God. Like, throw the whole hospital away. The one previously. That's all I gotta say.
Yeah.
It was bad. Like, I'm pretty good at acting like I don't care about certain stuff. And I'm also really good about just venting about how I feel about certain situations and then kind of being done with it. I have like a 3-vent rule and then I'm done. And I thought I would feel better about that because it's funny that you asked me that, but for the people listening, Dero and I kind of came up with this rule when we left this place that we were no longer mentioning this place. And man, it randomly just comes up in our conversations or with other people because I'm like, I want to know, has anyone else had such a crappy assignment like that, It was terrible.
I'm sure people have had worse.
It's terrible.
I know ours was worse, but I think that's...
I don't know. I've told, people, what, I experience, and their jaws just drop. It's quite scary, honestly. I want to turn it around and make this positive and say, the place that I'm at, it's not perfect, and I feel like anywhere you go is going to be flawed, especially in healthcare, especially during these times, and everything else going with media and whatnot, but I will say I'm very happy where I'm at, and although, driving for a long distance sucks, I get safe patient assignments, 1, devices are 1-to-1, and in a CVICU, those who work CVICU know that that's huge. I worked in a CVICU previously, my home hospital, where, like I said, I would have somebody on CRT and an Impella, okay, and then my other patient would also be on CRT, or they'd be a fresh off post-op day 3, like a transplant, which provides, you have to provide a lot more care than your basic cab. So it was just crazy. So it's just back on this assignment, I am happy. You have your crappy days, and it's weird doing tele. We'll have to do another podcast about that. I kid you not. So with these, this is a side note, but with these tele rooms, there's no windows at the doors, and most of them want their doors closed. So I'll be going in there every 5 minutes. Hey, you okay?
You breathing?
You breathing? All jokes aside, though. But besides the whole tele thing, I do appreciate it. And sometimes bringing back that side of tele just kind of reminds you why you like to interact with patients, and just kind of, you sometimes get that validation back from the patients when you discharge them, oh my God, thank you so much. I'm like,
yeah, we're gonna have to have a whole another episode on taking care of these tele patients.
Man. So I'm happy. I would definitely say I'm 100% happy. I did not expect for an assignment to actually be normal. I legit have PTSD. All jokes aside, I really feel like I do, because I try not to relive those moments that I had in that last assignment. But whew, what about you? How do you feel in comparison to our last visit in hell compared to this one?
I love the hospital we're at.
Mm-hmm.
I'm working night shift, which I knew. It's just one of those things.
Right.
I don't hate night shift. it just is what it is.
Yeah.
But what I do like about where we're at now is our management, and like they're trying. You know, like you said, every hospital isn't perfect, but you bring issues up or you bring problems up with your patient, and the team is trying. You know, they're going to try to reach out to the right person for you. They're going to look at the policy for how things are supposed to be done.
Right.
And that's important. You know, like that's what policies are for.
Exactly.
But whenever people can't find the policies, they're just doing whatever they want to do, and you're seeing that.
That's what's wild.
It's like, bro, where am I at? You know? And then it's like, you're not a manager, you're just a traveler. So like, who are you to really like speak up? It puts you in a very awkward situation.
Right.
You know what I mean?
And I've even heard of some people speaking up in certain assignments and getting fired.
Getting canceled.
Like,
that's crazy.
That's what's crazy.
I'm here to help you.
Like, I'm here for you. Like, I'm here for you.
Cancel me?
Cancel me? Because of what something you did?
That's crazy.
Yeah, man, that's crazy. So, this assignment, I'm very thankful for it. You know, like I said, there's some hard days, but at the end of the day, they have stuff that makes sense. Like, I can't even go into details, but it's like, wow, y'all actually have this. I'm shocked. You know what I mean? So, just super happy that, it sucks that we did go through that experience, but I feel like we were able to take a bunch of gems out of those negative situations and learn how wrong some of these things are that we obviously knew, but changes the perception on it. Like, whoa, like, you know, not everyone goes into nursing with good intentions, unfortunately. Yeah. And I wouldn't even say the word intentions, but I just think laziness is...
we've seen some...
lazy
stuff. What is kind of nerve-wracking about this assignment, too, is that we don't have intensivists on the floor at night.
Yeah, you've mentioned
so we have to, like, your judgment call as a night nurse is like, okay, I know I'm calling this doctor at 2 a.m. to wake him up. Like, is this important enough for me to call him?
Yeah.
You know?
Yeah.
And like, you have to really go through your progression of like, what can I do? What orders do I already have? Can I talk to the charge nurse? Is this something that the hospitalist can handle, or do I need to call the specialist? It's like a whole nother dynamic that I've had to learn on the night shift.
Right.
Because I'm used to having intensivists at night. Not that I work night shift all the time, but when I did, it was like, yeah, like we can talk to NP right here. Like, she gonna come see the patient. It's no problem. Here it's like, like, yeah, we've talked about that, and some of the medications the patients are getting that they should have gotten something different.
Right.
It's just...
And I think that's why I like day shift, because Cordero knows it. If y'all, whoever listens to this and knows me personally, like, outside of nursing, I'm a fixer person. So if something's broken, I like to analyze the situation, be like, all right, so what do you want to do? You know what I mean? Like, how are we going to fix this?
So now what?
Like, moving forward, okay, yeah, like, what now? And so I'd probably be a huge pain in the ass at night. So I'm glad that I do night shift, because
they will be so
I'll call the doctor. I'm gonna call you. Hey, like, I need you, bud. Like,
they're gonna be so pissed at you.
Well, all jokes aside, though, like, I think in the day shift, it's a good thing that I'm in day shift. It fits my personality. And the thing is, you've gotten a report from me. You could probably say I take care of majority of the things that need to be taken care of.
That's what's so important about day shift, making sure they get things done. Like, make sure that we have all the orders that we need, so that way my night goes smooth.
Exactly.
Like help me.
Help me.
Help the patient.
Well, I think it's just more important to understand the foundations on how day shift versus night shift in certain facilities work, because me knowing that and finding that out first day, my main priority was, like, obviously keep the patient safe and alive, breathing, etc. But also, like, what can I check off this list in order to make night shift easier? That way, maybe they'll be nice and bathe my patient, you know?
Yeah. People don't think like that.
But they don't, and I think that goes back to standards of care as well, and, like, you know, unit creating policies in order to just make everyone's shift just a little bit easier by everyone doing the same thing. You know what I mean?
Yeah.
But to each their own. Like I said, every facility that, you know, we've both worked at has some kind of flaws. So I will definitely recommend this facility 8.5 out of 10 stars for sure.
Okay. Well, all right, guys. Thanks for tuning in. We will catch you next time. Peace.
Bye.